As a caregiver, your daily activities may include assisting with personal needs such as dressing, eating, bathing, and going to the bathroom. Practicing these skills will give you the confidence that comes from knowing you're doing the best you can. Mouth care is important because it will help prevent mouth odors and infection. When preparing to brush and floss teeth or provide denture care, begin with a mouthwash rinse by creating a half water, half mouthwash mixture in a small drinking cup. Place a towel across his chest to protect his clothes and the bed linens.
Okay.
Place a basin on the towel under his chin and give him a small amount of the mixture to rinse his mouth, and catch the liquid in the basin.
Good.
Then, wet the toothbrush by pouring mouthwash solution over it, and apply toothpaste.
Okay, open wide.
Move the brush back and forth on the outside of the upper teeth, using very short strokes and a gentle scrubbing motion. Scrub the chewing surfaces of the upper teeth. Put the toothbrush vertically against the inside surfaces of the front upper teeth and brush with a gentle up and down motion. Brush the lower teeth and gums in the same way, and brush the tongue very gently. After you have done the mouthwash rinse, have your loved one, with clean hands, remove her dentures and place them in the denture cup. Once the dentures are removed, you will need to clean them using a toothbrush and toothpaste. Here's what you do. Line the sink with a washcloth so that if you drop the dentures, they will not break. Fill the sink half full with cool water. Clean the dentures with the toothbrush by brushing all surfaces. Very often, you may find yourself having to both dress and undress your loved one. To assist with undressing, help your loved one sit down on the side of the bed rather than stand. Sitting down prevents him from having to balance on one foot and possibly falling. Help him take off his shirt. If he has a weak or paralyzed side, remove his clothing from his strong side first, but when you help him dress, put clothing on the weak side first. Help him remove his pajama top. Then, help him remove his footwear and socks. To help him remove his pants, it is safest to have him lay down in bed. For privacy, you may cover him with a blanket or towel. Ask him to raise his hips so that you can reach under the blanket to help him slip his pants down.
If you're real, first going to undo this button.
If the person in your care cannot raise his hips to wiggle out of his underpants and pants while lying down, follow these steps.
Away from me.
Unfasten the zipper, buttons, or ties and turn him on his side and pull the pants over the buttocks and hip on that side. Repeat the process on the other side and the pants can be easily pulled off.
All the way back.
Keep your loved one well covered to provide privacy and warmth. Make sure the room is warm and that there are no drafts. Check the water temperature, confirming that it is below 105 degrees Fahrenheit. Use proper body mechanics as you wash your loved one and move him from side to side. Inspect his skin for injuries, changes in condition and color, reddened areas or sores. When giving a shampoo, cover his eyes with a washcloth. If your loved one is confined to the bed, he can be bathed and shampooed in bed. This is called a bed bath. If a metal bedpan is used, warm it first by running warm water over it. Have your loved one lie on her back with knees bent and place the bed protector under her hips. If there are no open sores on your loved one's buttocks or tailbone, sprinkle baby powder on the seat of the bedpan to make it easier to slide on and off. Ask your loved one to bend her knees and raise her buttocks by pushing against the mattress with her feet. Help by slipping your hand under her lower back and lifting slightly. Place the bedpan with the open end toward the foot of the bed under the buttocks. Help your loved one to a sitting position on the bedpan if possible. If your loved one is unable to help, turn her onto the side facing away from you and place the bedpan firmly against the buttocks. Gently turn her back onto the bedpan. If it's safe to do so, leave your loved one alone for privacy once she is seated on the bedpan. Before leaving the room, Place toilet paper and a call signal, such as a bell, within easy reach. To remove the bedpan, put on disposable gloves. Ask your loved one to bend her knees and raise her buttocks by pushing against the mattress with her feet. Help by slipping your hand under her lower back and lifting slightly as you remove the bedpan and bed protector. Avoid sliding the bedpan against your loved one's skin. When finished, take the bedpan to the bathroom and empty it into the toilet, checking the contents for anything unusual. When you return to your loved one, bring a basin, soap, water, and towel so that she can wash her hands. When she's finished, return to the bathroom to clean the bedpan. First, rinse it with cold water and then wash it with cool soapy water and a toilet brush. Rinse the bedpan well and dry. Cover the bedpan and keep it out of sight when it's not in use. If the person in your care is not able to wipe after urinating or having a bowel movement, you'll need to wipe, wash, and dry her.